I'm Tana and this is Casey, and we are here to talk to you about sleeping habits.
So, everything that a person does from the beginning of their day to the end affects the way they're going to sleep. Sticking to a healthy sleep schedule is the same as having a healthy sleep hygiene. And sleep hygiene is just a variety of practices and habits that allow a good nighttime sleep that leads to alertness during the day. And so having a lack of sleep interferes with everything you do in life, not only how you feel, but all your decisions you have to make. Our sleep schedule can be easily sabotaged by certain habits we have in our lives. So symptoms of sleeping habits, bad sleeping habits, constant tiredness, temper and moodiness, loss of concentration, loss of coordination, loss of appetite, and problems with relationships. And some things that you should avoid before going to bed are avoid eating before bed, avoid using technology, avoid odd sleeping hours, and avoid caffeine or any other liquids or fluids, And you should try to keep your sleep schedule the same by going to bed and waking up at the same time. Sticking to this schedule will help your sleeping patterns, allowing you to get better night's sleep.
And then benefits of good sleeping habits. It will boost your mood, improve memory, can benefit the heart and mind and weight. Your quality of life will increase, reduce inflammation, increase creativity, improves performance, improves the grades, increases attention, decreases stress. You'll get a healthy weight, avoid accidents like car accidents, decrease chance of depression. And then do you guys think you're getting enough sleep?
Mm-mm.
No? Okay. Well, these are sleeping tips that can help you help you get better sleep at night. You can keep a constant sleep schedule, so that's what Casey was saying about make sure you get up at the same time on days and weekends. Set a proper bedtime. Go to bed when you're tired, so don't go to bed and watch Netflix just because. Don't lay in bed longer than 20 minutes. Create a relaxing time before bed. Keep the bedroom at comfortable and cool temperature. So the temperature in your bedroom should be at least 60 to 67 degrees because when your body drops in temperature, it will help you feel more relaxed, which will make it easier for you to fall asleep. Limit bright light exposure in the evenings because bright light will wake you up. Exercise regularly and maintain a healthy diet. And then these are different symptoms or different sleeping disorders that you can have. So there's sleep apnea, insomnia, sleep deprivation, restless leg syndrome, and night sweats are the most common. And then women have insomnia and sleeping disturbance more than men. So 1 out of 3 only get a few nights a month when they wake up feeling refreshed.
So do you guys know the differences between the sleeping disorders? No? Okay. So sleep apnea is where you have one or more pauses in breathing or shallow breaths while you sleep. Insomnia is where you just cannot fall asleep. It's difficult and you stay awake usually. Sleep deprivation is not getting the right amount of sleep. Restless leg syndrome is tickling or twitching sensation in the leg muscles when sitting or lying down, which can only be stopped by moving your legs. And night sweats are extreme sweating, so waking up to your night clothes or bedding being soaked, and this could be related to a medical condition or illness. What causes them? There are many conditions, diseases, and disorders that cause sleep disturbances. Allergies and respiratory problems can also interfere with falling asleep, making it difficult to breathe while sleeping. There's also nocturia, chronic pain, and also stress and or anxiety that can keep you up. Nocturia or frequent urination may disrupt your sleep by making you get up in the middle of the night. Chronic pain such as arthritis, fibromyalgia, chronic fatigue syndrome, and continuous lower back pain cause continuous pain which makes it uncomfortable to sleep. Stress and anxiety. They have a very negative impact on how you sleep. You're constantly worrying about something, so your brain is being active while it should be resting.
And then there's if you have really bad sleeping habits, there's some things that can be caused from that. So you can get nightmares, which are vivid and disturbing content and dreams. It's normally caused from anxiety and depression. It is common in adults and children, but for children it is most common in REM sleep, which is rapid eye movement sleep, or else there are sleep terrors, which are most common in non-REM sleep. It is caused by sleeping disorders like sleep apnea and restless leg syndrome. The children and adults have a good recall of what the dream was. Night terrors include arousal, agitation, large pupils, swelling, and increased blood pressure. The children get scared and they normally scream, but they will eventually relax and they'll go right back to sleep. Sleep terrors normally take place early in the night and can be combined with sleepwalking. They normally don't remember or only have a vague memory of what their dream was like. Then there's REM sleep, which is rapid eye movement behavior disorder. It's when people act out what they're dreaming. It can be treated by creating a safe environment, so putting pillows where the corners are so you don't run into them. Or else there's certain medications that you can talk to your doctor about. It can occur while sleep talking, hitting, screaming, punching, and falling out of bed. Most noticed when it causes danger to themselves or the person that's living with them. It occurs during REM sleep. During the state, electrical activity in the brain is recorded by electroencephalogram. Looks like the electrical activity that occurs when you're awake. Neurons in the brain during REM sleep are functioning like they do when you are awake. REM sleep is also characterized by temporary muscle paralysis.
So, how are sleep disorders diagnosed? The doctor will do a physical exam and ask you about your medical history. As we mentioned before, there is the polysomnogram test, but also there's electroencephalogram, and there's genetic blood testing as well. In the polysomnogram test, it studies the oxygen levels, body movements, and brain waves to see how they interfere with the sleep. The electroencephalogram assesses the activity in the brain and detects any problems. And then the genetic blood testing is mainly used to diagnose narcolepsy and other health conditions that may be causing the sleep problems. And narcolepsy is just another type of sleeping disorder.
And then there's also it's considered a sleeping disorder, sleep talking. Sleep talking is a sleeping disorder that the individual starts talking during their sleep and they don't even realize it. It can be complicated, like their talk can be really complicated, you won't understand what they're saying, or else you can completely communicate with the person. It is rare and short-term occurrence. It is more common in males and children. The voice and type of message or the language could sound different than them being awake because they're not aware of what they are saying. It can be spontaneous or it can be induced by conversation with the sleeper. It can be from past experiences, relationships, past events, or just random events that just don't have an emotional impact or relevance anymore to them. The people that are sleep talking are not conscious or have a rational mindset. Sleep talking can cause embarrassment, annoyance, or disruptive to others. Can be scared to sleep away from home, which can cause insomnia. It's caused by stress, depression, sleep deprivation, daytime drowsiness, alcohol, and some fever. Sleep talking can run in families. External factors seem to stimulate the behavior. Concurrently with nightmares, confusional arousal, sleep apnea, and REM sleep disorder. Mental or medical illness mostly occurs in 25 years or older for adults. Signs and symptoms, it can occur in any stage of sleep, so it could be when you're lightly sleeping or when you're more into your deep sleep. The lighter sleep is when the more intelligent sleep talk is happening. There is mild, moderate, and severe symptoms. The mild episodes occur less than a week. For moderate episodes occur more than once per week, but less and causes mild disturbance to the person that you're sleeping with. Severe episodes occur nightly and may cause pronounced interruption of the person. The duration, there's acute, which is less than a month, subacute, which is longer than a month but less than a year, and chronic is a year or longer. The treatment is not very necessary. If it's chronic, talk to your physician or healthcare provider about it. You want to keep a regular sleep schedule, adequate amounts of sleep, proper sleep hygiene, and refrain from alcohol, heavy meals, excessive amounts of stress. And then there's sleepwalking. And sleepwalking is a behavior disorder that originates during deep sleep and results in walking or performing other complex behaviors while sleeping. More common in children than adults. More likely to occur in sleep deprivation. It's difficult to waken the person up, but the person will not remember why they were sleepwalking or where they're at. It can also occur when the person sits up in bed, looking around, walking around the room or the house, leaving the house, or even driving. Common misconception is that a sleepwalker should not be awakened, but it's actually more dangerous not to wake up the sleepwalker. There's 1% to 15% of the population that are sleepwalkers. Common triggers are sleep deprivation, sedative agents, including alcohol, some type of illnesses, and certain medication. Children ages 3 to 7 have a higher occurrence with sleep apnea. Sleepwalkers are more common with those who experience bedwetting. So signs and symptoms initiate during deep sleep but can also occur in light sleep, usually within a few hours of them falling asleep. Other symptoms of sleepwalking can also be sleep talking, and you'll have little to no memory, difficult arousing the sleepwalker, so you won't be able to wake them up very well. Inappropriate behaviors such as urinating closets, more common in children, screaming, and violent behavior. Alcohol and other medications can cause this. The treatment, there is no specific treatment to it, but improving your sleep hygiene can help. Talking to your doctor. Adults can stop from sleepwalking from getting hypnosis. There's sedative things like antidepressants, and the children normally grow out of it after a certain age. There's coping skills like increasing the amount of time scheduled for sleep, regular relaxing time before going to bed, and creating a safe sleeping environment. There is 1% chance of preschool children and 2% chance of school-age children that walk in their sleep at least a few nights per week.
So how are disorders treated? They can be treated by a combination of medical treatments and lifestyle changes. Medical treatments include sleeping pills, allergy or cold medication, breathing devices, or a dental guard. Lifestyle changes can change the way you use to sleep, taking the bad habits that you are used to doing out of your life. And living with a sleeping disorder can be very difficult, so making sure that you stick with your treatment plan and letting your doctor know how you're doing, it will help you find a better way to get over your disorder. And then there are different types of sleep patterns. The main one is monophasic. It's the normal sleep. A person sleeps for around 8 hours a night. This is the most common sleeping pattern, but there's nothing abnormal about it. Biphasic is a person sleeps twice a day, consists of long sleep during the night with a short rest during the day. And then there's polyphasic, having multiple sleeps per day, ranging from 4 to 6 periods of sleep a day. And which one is better? The polyphasic is the better sleep pattern. It aims to maximize deep sleep and it reduces light sleep, so that the amount of time sleeping is decreased.
And pregnant women are also can have really bad sleeping habits. So there's 78% of pregnant women that have a sleeping disturbance. They feel fatigued in the first and third trimester, changing because it's from your hormones changing. Your hormone levels can affect the inhibitory muscles, which cause you snoring, and in obese women, it can increase the risk of developing sleep apnea and frequent trips to the bathroom. Experience insomnia is from emotions and anxiety about labor and delivery, balancing motherhood and work, or changes in their relationship with their spouse or with their parents. And it mostly occurs with the first-time mothers, then the second time or third time. It is harder to get them to sleep when the baby is born as well. 26% get restless leg syndrome. They can get heartburn, sleep apnea, sleep apnea is more common in overweight women and can cause a low birth weight. It can affect the labor, which the labor can become longer, and the delivery is 4.5 times more likely to have a cesarean. The treatments, they're drug therapy, but that can cause harm to the fetus, so you need a good sleep hygiene instead. Restless leg syndrome is from having low levels of dietary folate and or iron. You can take supplements for that, and that won't cause harm to the fetus. It tends to go away when the baby is born, but there's still chances that you would still get sleep disturbance when the baby is born. And you would have to make sure you watch your sleeping, because there could be new problems that arise from having the baby. There's different coping strategies, so you can plan, schedule, or prioritize your sleep. Try to exercise for at least 30 minutes per day if the doctor recommends that you can exercise. Make sure you sleep on the left side to improve the blood flow and nutrients to get to the fetus, uterus, and kidneys. Avoid laying on your back for extended periods of time, so that could cause harm to the fetus. Drink lots of fluids during the day and try to avoid it at night. Don't eat large amounts of spicy, acidic, or fried foods to stop your heartburn. Small meals throughout the day, and don't force yourself to sleep if you're not tired. You would want to place a pillow between your knees, under your abdomen, and behind your back to prevent pressure being applied to your lower back. Use a night light to get up to use the washroom, so you don't have to turn on the light, because the light can wake you up, and then you won't be able to fall back to sleep. And add naps if you absolutely need to, but it's better to not nap. But if you do nap, it'd be earlier in the day if you have difficulty sleeping at night. And there are multiple tests used to help indicate what type of sleeping disorder you have, and there are treatments that can help, such as the polysonogram, and that is a test that electrically transmits and records specific physical activities while you sleep.
And when it comes to napping, you guys want to make sure that you're not taking too long of a nap. You want to take a short nap, about 20 to 30 minutes, and it can improve your mood, alertness, and performance.
And then, do you guys know what position you guys sleep in when you're sleeping? Or is it kind of like wherever? You sleep on your stomach?
Yeah.
You guys all sleep on your stomach. Mm-hmm. Well, you guys are in the rare population with sleeping on your stomach. There's 48% that sleep on their backs, 21% that sleep on their left side, 20% that sleep on their right side, and 11% on their stomachs, which are 30%.
I feel like I can sleep on the other side.
Yeah.
But I always wake up on my stomach.
Okay.
Average amount of sleep that a teenager should get is about 8.5 to 9.5 hours. And then for adults, it's 7 to 9 hours of sleep. So, do you guys have any questions?
Do you guys get enough sleep?
No, definitely not.
No, school's too stressful. Thank you for coming and watching our presentation.
Thank you for listening to our presentation.
Okay.